The golden rule of pregnancy: never use an unproven drug in pregnancy, and never vaccinate in pregnancy. Never. So,
and
somehow never went away. Never went away during COVID. That golden rule was broken. The last people that should get new drugs, unproven drugs, or vaccines should be pregnant women and the fetus inside them. They should be 10, 15 years out if you've got a wonderful new vaccine to use. Polio would not have been given to pregnant mothers in the early days. Not a chance. And actually has been discouraged ever since. You don't vaccinate pregnant mothers. It's medical malpractice. Why have we allowed ourselves to do a medical malpractice, ostensibly recommending it? And what has been the result? What has been the result? Well, Pfizer knew the results just as things were rolling out. They did a post-marketing analysis. And in their post-marketing analysis, there was about 300 people that they didn't tell you what happened to the other 270 or so. They didn't give the answer back, but they did give the answer for 29 pregnant mothers. And the 29 pregnant mothers that they gave the answer to, what happened to the pregnancy? And it's published. It's part of the 75,000 pages of Pfizer data. And the published data by Pfizer showed that of the 29 pregnancies that they were willing to say what the results were, and the others that they hid, 28 out of 29 lost the pregnancy. A horrific number. 97% of the fetuses were lost, of those 29 that they were willing to tell us about. Of course, they weren't really willing to tell us about it because they thought that these data would be hidden for 75 years. But the truth, when Dr. Naomi Wolf and others got to the truth, is that this cache of dear families who lost the ability to have this child in a ratio like that, 97% in that group lost. The actual real-world data, the real-world data where it's really being spoken of and proven, hospital systems in Florida, hospital systems in other parts of the states that are being honest about it, show that 50 to 67% of pregnancies, while the woman has received the vaccine while pregnant, 50 to 67% of those pregnancies are lost, either early or late. Incredible numbers. Anyone in the obstetrical units really knows the truth. They've seen stillbirth numbers that are obscene. They've seen early pregnancy losses, extra bleeding, spontaneous bleedings, and spontaneous abortion losses that have happened that are obscene numbers. And this is what happens when you break the golden rule of pregnancy. Do never break the golden rule of pregnancy. Do not vaccinate, and especially do not vaccinate with a toxic spike protein into a viable human who's only this big. A little viable human that's only this big, and nanoparticles take the toxic stuff across through the placenta and into the cord and into the baby and into the baby's brain. And the mother received the shot when the baby was 3 months old inside her body because society was telling her, that's the way you can protect yourself. That's the way you can protect grandma. You just do it too. We were lied to. We were lied to. We didn't know if it was safe or not. We now know absolutely that it's not safe. And one of the biggest evidences that it's not safe was in this highly risked population, mothers and the children within them.